Hey guys, today I want to talk about stretch marks during pregnancy. Why do they occur? What can you do to prevent them? Do the creams on the market really work? And what can you do once they do occur? Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. Stretch marks, I think it's something that all expecting moms think about and really dread and pray that it doesn't occur. Even though it's not dangerous, it doesn't signify anything about the health of your pregnancy, the health of your baby. It certainly can cause a lot of emotional and physical distress on the expecting mom. I mean, they certainly, of course, aside from the appearance, can be itchy and asymptomatic. And we still don't really know why stretch marks occur. We do know that there are certain risk factors and every pregnancy is different. And sometimes you may be doing all the right things and they still occur. Well, just to give you guys a little bit of information, stretch marks have been reported up to 90% of pregnancies. So certainly something that most moms will experience at some point. And they typically occur during the second and third trimester of pregnancy, really during those periods of time where there's more rapid growth as the baby is growing and the skin is stretching. And commonly occurs on the body where skin is most likely to stretch, like on the breasts, on the abdomen, one of the most common places, as well as on the buttocks and thighs. They initially can look pink and purple in color, and then over time become more white, and the skin will often be more stretched and wrinkly from that scar-like tissue texture essentially. And initially it can be very itchy when they first develop. Now, as I mentioned earlier, we still really don't know why stretch marks occur in general. I mean, certainly we see stretch marks not just during pregnancy, but during other times, for example, during puberty, where individuals may again experience rapid phases of growth or when there are fluctuations in weight. Now, for pregnancy, we know that there are certain risk factors. They include a family history of stretch marks, as well as a personal history of stretch marks. Now, whether that is previous pregnancy-associated stretch marks or stretch marks that have developed during puberty or with changes in weight. And certainly every pregnancy is different. As I mentioned earlier, I have a lot of mom friends who did not develop stretch marks with one baby, but did with another. Okay, so what can you do during pregnancy? So since we know that stretch marks are more likely to occur during rapid stretches of skin, first and foremost is just to keep steady weight gain and try to do everything you can for benefit of your pregnancy, the benefit of your baby, and to minimize potentially the development of stretch marks. So making sure that you don't have those periods of time where you experience rapid weight gain. Now, as far as products on the market and what you can do on a regular basis, number one is just keeping the skin on your abdomen, on your breasts, on your thighs healthy with the regular use of a moisturizer. There is very limited evidence that any products on the market marketed towards stretch marks really work. And there are studies out there that have looked at cocoa butter, olive oil, almond oil, bio oil, what have you. And you guys, most of them don't work, and studies have shown that. If you want to try something that is safe during pregnancy, I would invest your money instead of in almond oil or cocoa butter into two products that have some evidence based on clinical studies to potentially help either the development of stretch marks or minimizing the severity of stretch marks once they do occur. These two creams have been studied in what's called a randomized, double-blinded, placebo-controlled study, which is essentially the best study that you can structure to look at whether a product is truly effective or not. And interestingly, both of these creams contain Centella asiatica as one of the main ingredients. In addition, the two creams differ slightly in the other proprietary ingredients, but they also have a combination of like vitamin E as well as hydrolyzed collagen and elastin ingredients. Now, we certainly know that Centella has been studied and is helpful in the setting wound healing, and it's anti-inflammatory. What we don't know is it really Centella that is really working here? Because certainly Centella, there's no shortage of Centella products on the market, right? But not every Centella product has been really used for stretch marks and have been shown to be helpful. Or is it Centella in combination with these other ingredients? But regardless, these are the two creams that have been shown in well-structured clinical studies to potentially help. So what are these creams? The first one is called trofolastin. Now, I have personally not used any of these creams myself. I will share with you guys my simple routine, but this cream is something that's not really readily available. You certainly can find it on Amazon, and that's where I I have in my search for this cream found it to be the most easy place to purchase this product. But this contains centella, hydrolyzed collagen, elastin, as well as antioxidants. And what the studies have shown in 80 women who basically was divided into two groups. So one group that used the cream, one group that basically used a similar vehicle cream but without these active ingredients. And what they did is start applying these creams to the buttocks, breast, and abdomen starting at 12 weeks of pregnancy until delivery. And what they found was that the group that used the trofolastin cream had a 56% decrease in risk of developing stretch marks compared to the placebo group. But what was interesting was that the subjects that were less likely to develop the stretch marks that used the creams were mostly individuals that had a prior history of stretch marks during puberty, but not from previous pregnancy. We don't know why that's the case. So basically the take-home message is that trofolastin cream may help the development of stretch marks, but certainly may help to reduce the severity if they do develop. The other cream is from Isden, and it's called Isden Women Anti-Stretch Mark. And again, this contains a proprietary blend of vitamin E, rosehip oil, I believe, as well as centella extract. In this study, they had a larger group of 183 women, again divided into two groups. One used the Isden cream and one used a placebo, and started applying at 12th week of pregnancy to the high-risk areas and until delivery. And although the results showed that both groups developed stretch marks at the same rate, the group that used the Isden cream, the stretch marks when they did develop did not get worse over time compared to the placebo group, which in that group, the stretch marks did worsen throughout pregnancy. So potentially, again, a cream that may help the development of the stretch marks, but at the very least, if they do develop, may prevent the stretch marks from getting worse. What has not been shown to be helpful is olive oil, almond oil, cocoa butter. Just by keeping your skin healthy and hydrated with or without massage, if massage is something that you like to do, I think is helpful, because when your skin is dry and inflamed and cracked, certainly it's just not a healthy baseline, and certainly that itself can predispose just any sort of trauma to your skin. Now, what I do in pregnancy right now is I just use a good moisturizer on my body every single day. I really don't have a lot of time with my 4-year-old daughter for massage, but certainly if massage is your thing, keep in mind that it is something you want to do like regularly, and you want to spend a good 10 to 15 minutes doing the massage. So it's certainly something that is time consuming, but just understand by simply using a moisturizer to keep your skin healthy can be helpful. And really that's what I recommend, and that's what I do. So if you've done all the right things and stretch marks still occur, what can you do? So this is really where obviously prevention is helpful, but understand that there are great treatment options available too that can help minimize your appearance if you do get them. The first thing is topical tretinoin. Now, obviously this is something that you want to reserve postpartum. Tretinoin certainly has been shown to be helpful not only in collagen production, dermal remodeling, but it's also been shown to reduce the severity of the red appearing stretch marks over time with use, and certainly can be helpful. So something that you can start immediately postpartum, and yes, you can use tretinoin postpartum. It is safe to use during lactation, assuming you're not putting it on your nipple, but certainly on your abdomen, on your thighs, on your lateral breast, even on your face for acne, anti-aging, whatever you want to use it for. But topical retinoids are safe to use during lactation. So that's the good news. Now, the best treatments are really in-office procedures. So resurfacing procedures, lasers, microneedling are really what's going to be helpful. And these are basically treatments that will help to stimulate collagen production, dermal remodeling, and over time really help to improve texture change from the stretch marks. Another laser that has been shown to be helpful is called a vascular laser, so a pulse dye laser. And these will help when the stretch marks are pink in color because it really targets the hemoglobin or the redness in the skin from the blood vessels. And even though they may not be effective or truly help in changing the surface texture of your skin, studies have shown that by just helping with the redness and the inflammation, it does help with wound healing and stimulating a lot of the skin responses that can improve the appearance of scars, stretch marks. So talk with your provider on those options and what you can do. Understand that with a lot of these procedures though, it does require at least a couple sessions at the very minimum, and sometimes improvements come over time with treatment, many months even after, say, you've had them done. done. It's like, for example, microneedling, many times the improvements are seen 6 months after you complete the treatment course. And so this is where combining with good moisturizer, tretinoin use at home, along with in-office procedures can really give you the best improvements in the stretch marks, in the appearance of the stretch marks. Certainly, I don't think there is a wrong product you can use unless it's causing irritation. Like I said, do what you are comfortable doing. Not that the products on the market are harmful, it's just that there is really no evidence to show that they help in preventing stretch marks. So again, do what you're comfortable doing, do what you like to do. Most important is just to keep your skin hydrated and moisturized with a regular use of emollient, a cream, an oil. Massage may or may not be helpful, and understand that sometimes you do all the right things and it still can occur, and this is where in-office procedures can be very helpful and a lot more options available postpartum as well. Comment below, what are your experiences with stretch marks? What have you used or things you've done that you found to be helpful for you? I would love to know. And then I would appreciate it if you could subscribe to my channel and give this video a thumbs up. Also, let me know if you have any other pregnancy related skincare questions. I would love to make another video for you guys, and I will see you guys next time. Bye.